But we do have some,
It's coming.
we have some, yes, and maybe we'll even get here.
It might get here early.
It might get here partway, which means that we'll have to interrupt our speaker, for which I apologize in advance. But students have limited time in between their morning and afternoon classes, so I know that they are eager to be fed. So should we get started while people are still signing in?
Well, let's just wait a
Or you
little
want
bit
to wait a little
longer.
bit? Okay.
We'll wait another minute or two and
Okay, so you will give me the high sign? Professor
yeah.
Rona? Okay.
we'll, I will give you the yes. Would you, yeah, Mike.
You want to do that?
You know, I don't, I'm really bad. Unless I'm in a military setting, I would not do that very well. Yep.
Very nice. Yeah, but it was just coming down. It wasn't like, yeah, it wasn't anything dramatic. It just, you know, it's class circumcision, you know, you just came down and like my foot landed on the rope. Matt just like exploded. So, you know, working on it. I can walk, just kind of can't like run or jump though. I can't like do many. All right. Also,
You're fine, you don't need to.
So, good afternoon. For those of you who don't know who I am, I'm Aviva Must. I'm chair of the Department of Public Health and Community Medicine and also dean for the Public Health and Professional Degree Program. And it is my absolute delight, privilege, and pleasure to introduce today's speaker. Dr. Mahmood was born in Cox's Bazar, a small seaside port town in Bangladesh. In the nearby town of Chittagong, he completed his high school and college education and graduated from Chittagong Medical College, University of Chittagong in 1987. After a short period of time training at a local mother and children's hospital in Bangladesh, Dr. Mahmood moved to the U.S. For higher education. Subsequently, he completed specialized training in pediatrics from Brooklyn Hospital in New York and fellowship training in subspecialty of pediatric endocrinology in New York Hospital Cornell University's Medical College. Dr. Mahmood established HOPE Foundation for Children and Women and Children in Bangladesh in 1999 in the USA as a charitable organization whose mission is to provide health care to the poor and needy mothers and children in Bangladesh. And there's more text here, which I'm not going to read because I believe that Dr. Mahmood is going to share some more of that with us in his talk. So welcome, Dr. Mahmood.
Good afternoon. Thank you, Dean Aviva Must, for kind introduction, and thank you, Dr. Ona, for inviting me. Distinguished faculty, students, it's my honor to be here. And this is the first time I'm in Tufts Medical School, but I have heard a lot about this school, and I have read that it's one of the top-ranking research institution in the world consistently for many years. So it's my honor to be here. I'm going to actually talk about my story, my journey, because I'm a physician like you that I was trained, many years ago. But I have, instead of like going in the normal way of doing things, I have done things differently. That's why I'm here, and I'm going to share my story. Maybe some of the young students will be motivated because it sounds very meaningful, what my journey took me to. I founded HOPE Foundation in Bangladesh. So Bangladesh is, I was born right here, it's called Cox's Bazar. And Bangladesh is a little bit bigger than New York State, has a population of 160 million, which is half of the US, but US is about 66 times bigger than Bangladesh. Bangladesh got independence 48 years ago from Pakistan. It was a struggle. It was a huge struggle for 1 year. And at that time, I was 8 years old. And I saw when I was a kid, of course, and I felt that, it was a broken country, a lot of problems, especially healthcare. To find a doctor, you have to go many miles. So it kind of affected me as a kid. And also, I was very much close to my dad, and I was very loyal to him as well. So he told me that, I have to be a physician, and I listened to him, and I became a physician. Also, he told me that I have to work for the poor people, to help. And that's what my life journey was. And so just to, this is the airport at Cox's Bazar. Just to give you an idea, this is Cox's Bazar is a small town. It is one of the 64 districts of Bangladesh. Bangladesh is mostly a rural country, but we have an airport in Cox's Bazar here that I go to. And this is a beach. It's about 5 minutes from the airport. And this is a hotel that a lot of us stay when we go there, and it is a lot of foreigners go to Bangladesh. I'll get to that a little bit later, why. So there are about 15 to 10 hotels like this. The foreigners, they're comfortable, they live there, they have wife. It's very, very affordable. It's about $40 per day. And it's like, compared to his 4-star. So, as I said, when I was a kid, I was very much influenced by my dad. But I came to the U.S. I left Bangladesh about 30 years ago. I got training, what Dr. Rabima Mast mentioned, at pediatrics, endocrinology, and all this. About 20 years ago, that time I was about 10 years out of my country. But I never forgot what my dad told me, and I was very restless, to what to do. I came to a comfortable life, right? And so one day in May in 1999, I walked to attorney's office that she's a wife of a friend of mine who's an ENT specialist. I told her that I want to start a foundation, Hope Foundation. So I started Hope Foundation with her help. I wrote her a check, and then I went to Bangladesh. I started this. I rented 2 rooms in my hometown and hired a part-time physician. Started running. I spent $200 every month. That was 99. Then in 2005, I built this hospital here with some of my own money and some money raised from my friends. So that was started at 40 bed, but it was not easy. It was tough. Finding doctors, putting the procedures, policies, patients, building credibility. It was, huge struggle, and we all go through that. When we create something, that's what we go through. Then in 2011, we built this with the help from Japan government. It's a training center where we train the midwives and the nurses. So this is where we started in 2015, we broke ground for this center here. And it's going to be finished next year. It will be 75 bed, quite modern hospital. It's well architectured, and it will be suitable for, high quality care. And this will be a maternity and fistula center in our campus. So right now, in 20 years down the road, we have 21 facilities. We have 2 hospitals. We have some birth centers, rural health centers. We have centers for refugees, health center for refugees, midwifery training center, and I showed you one hospital is under construction, and some other midwifery training program is in the pipeline. It will be probably started next year. So I just wanted to share some statistics of Bangladesh, health statistics. The doctors, nurses population, 3 for 10,000 people. There are 3 doctors, 1 nurse, which should be actually other way around, 1 to 4, 1 doctor, 4 nurses. So we have a huge shortage of nurses. Maternal mortality is 196. In the U.S., I think it is less than 15. So 196 over 100,000. That means 100,000 women that become pregnant, because of pregnancy before or after 196 will, um, die. One of the problems is antenatal care is not, like sufficient, and also home delivery is very high because of lack of facilities. So Hope Foundation, I focus on maternal health. Everything that we do, mother is in the center. That's our philosophy, because I realize as a pediatrician that if I like kids, I'd like to treat kids. But I realize that if the mother is not in good health, the kids will never be in good health. So you have to address the root cause. So as you see, the maternal mortality is so high. Infant mortality is also high, but maternal mortality is strikingly high. And also if the mother is sick, the whole family gets sick. The community gets sick. Even if in a village, if you have 100 mothers or 200 mothers, whatever number it is, if you can take care of them, the village will thrive. They'll get educated, they'll get jobs, they'll be happy. The father also will work harder. They don't have to think about, like sick mom, right? A sick wife. So I hope our primary focus is, say, mothers. We have midwifery training program, safe motherhood program, rural birth centers, obstetric fistula eradication. I'm going to focus on these a little bit. A lot of people don't know, but people who know about it, they just, blown away by the condition. A lot of people don't know, because in the U.S., we don't have fistula anymore because of the maternal health, good maternal health. Humanitarian care that we are involved in, the Rohingya refugee crisis. Also, we do a little bit of this cleft surgery, burn surgery, mainly afflicts women, and cleft surgery also the kids. When the kids get cleft, mother is the most worried person about that. And also we do some telemedicine. So midwifery training programs so we started midwifery in Bangladesh since 2012. Before that, there was some midwifery training program. It was funded by the government in the United Kingdom and Canada. So we produce about 300 midwives every year. Now we have 3,000 midwives, need 25,000. So in my opinion, and everybody's opinion in Bangladesh, if we can train enough midwives, we can drive down maternal mortality seriously, because midwives are the ones who care about birth. So we are focusing on the midwifery program. And these are our these students of our midwifery school. They're very young. They're 19 to 22 years old. 3-year program, it's a diploma program. I have a movie here about, I don't know if it, just click on it. Yeah. I have 2 short movies. So that is the oath they take every single day, every day morning. They're very, they come from villages, poor family, but very dedicated. And our goal is to send them back. They're committed to going back to their own community and have their own female members of that community. And we set up, with their help, we set up these birth centers. So they provide antenatal care, safe delivery, high-risk referrals, and postnatal care, family planning, counseling, and some primary care. And they live there. So mostly, they am their assistant. At least a couple of people live there. So it's 24/7, even the remote areas. So this one of the midwife, her name is Aisha, and they are also kind of partly owner of these centers. So it's like a partnership. We set it up. We give them the partnership so they remain committed to it. Otherwise, they'll be, always have, like with jobs offers for NGOs and things like that. We don't want them to go away. So we give them partnership. They're very happy. They make good money and giving the basic services, and also they can send their kids when they're, they have their family as well. So this is one of the centers that I was there opening, and it's a village center. Also, we set up small shops there, like selling vitamins, Tylenols, and things like that, and sanitary, like female hygiene stuff, dental, like toothbrush, paste. So basic things they don't have to go to buy, and they can make a little bit of money from that to sustain their work. And they also go to the homes, and they don't mind going to the home. They're not like doctors. They don't sit in a camp, their business, They go out in the community, and they actually take care of the community. See, they're going to East Rohingya community. They're going checking. We also started doing conference. This was one of our midwifery conference. The first one we did in last month. You can see the dates here. Last month, it's less than a month ago. A lot of government officials came, and sponsored by a lot of, like influential organizations. Here you can see Save the Children, MSF is there, Canada, Swedish, UNFPA. So our effort is supported by a lot of big organizations there, which is very important because you need powerful organization on your side to do anything, And see, this is the conference picture here. We had 700 in Bangladesh. Out of 3,000 midwives, 700 came to our conference, and hopefully in the future we're going to get more and more because it's very important to involve them. And also we have these are international midwives who are in our conference. The speakers. This lady, she's a CNN hero. She's actually American, but she's from Dr. Ona. She's from Philippines. Is she from the Philippines? Yes, yes. Her parents are from Philippines. Yeah. And this is Hannah, this Dr. Ona's student, right? Right. She's there. She's been there for already 3 months. She wants to be there for a few years. Very dedicated midwife. She's the one who actually connected me to Dr. Ona. So obstetric fistula program, our partners, the government of Bangladesh. Very important in a country like Bangladesh, it's very important to work with the government. Because if you work with the government, if you're in their good side, success chance is higher. And the fistula, I don't know some of you probably don't know. Obstetric fistula is a hole between the vagina and the rectum or bladder that is caused by prolonged obstetric labor, leaving a woman incontinent of urine and feces or both permanently. For women with obstetric labor that goes unattended, labor can last up to 6 to 7 days. Obviously in a few days the baby dies and she's in a serious distress. Maybe she has to be taken to a hospital to get a surgery, or somebody will manually deliver the baby in the rural areas. And it happens to the poor people. Poor women, obviously, they cannot have antenatal care. They don't have the means to go to a physician. So it's a poor woman's disease, and say more than 75% of the women with fistula have endured labor lasted 3 days or more. So it's a severe problem. And they become incontinent for life. Poor labor, they are usually poor, labor attended by untrained, traditional professional practitioners, young age, separate from husband, unable to sustain married life, detached from extended family also, isolated, unemployed, depressed, live with chronic pain and shame from foul smelling. That's bigger problems. So all these things. So even though they're alive, they're basically, they want to die, And they're very depressed, they're out of jobs. So we work with them. Been working with them, that kind of condition for about 10 years. We became the leader in Bangladesh. We have trained surgeons that we send them overseas to fistula centers in Africa, and we got them trained. So we are #1 program in the country for fistula care. So what we do identify the cases, do the surgery, we give them skill development, jobs, and also we employ a lot of them in our kitchen, in our birth centers. We employ them as fistula ambassadors so they go out and recruit more fistula patients. Because fistula patients, by suffering for a long time, they don't believe that there is a cure. And also it's expensive, so they don't believe that they have the money, but we do it for free because through the grant, we do every fistula surgery from home until they go back. They get free treatment. And this is one I was really happy to see her, when I was there in like 3 weeks ago. So I knew about her because we, sometimes take pictures and promote, the cause. I used her picture. Her name is Nokima. I knew her from the pictures. I never met her. She got surgery 4 years ago in our center. And usually fistula patients, they're afraid to have babies, after the surgery. I was, so happy to see her have a baby girl, and it was just 2 days old. And we saw there are 2 gynecologists came from Dhaka. There are people. This is a surgeon, our fistula surgeon. So we went there. I was so happy. I talked to her. I say, she said that, I asked her, did you name the baby? She said, no, I didn't. So she asked us to name. So we named her Nabila. So but this is a really success story of a fistula patient. There are about 20,000 fistula cases in Bangladesh. Average, they say that about 2,000 added every year. Cost is $600. As I say, we do it for free. We also part of the Fistula Free Bangladesh campaign by 2020, in next 7 years. We're hoping to have Bangladesh no fistula. Of course, there's a part of the maternal health thing. You have to have good maternal health, so there is no maternal mortality is much lower. You have to have enough people to serve the mothers, as well as you have to do surgery on the fistula that's now prevalent in Bangladesh. And we work in this area. We are assigned to Bangladesh, these are 7 divisions, 1, 2, 3, 4, 5, 6, 7. So we work in these divisions. There are about 32 million people. So we are assigned by government to eradicate fistula from that area by 2030. And I just put this picture. It's a cleft patient that I met this kid as well last time when I was there. His name is Babu. We got him at 6 months age, and he's now 4 years old. And you can see the change, like the life change. We have done hundreds of maybe 600 cleft surgeries so far in the last 8 years. So Rohingya crisis, I don't know, anybody know about Rohingya here? So they're ethnic, for people who don't area. The Rohingya people are the ethnic minority in Myanmar. You know, they have about 30 years ago, Myanmar government passed a law in their parliament, and they took away their citizenship rights, all kind of rights. So they didn't have health, education, and civil rights. And because Cox's Bazar area, Bangladesh and Myanmar are border country, and Cox's Bazar area is the border. So, and a lot of them, they look like Bangladeshi people, that Rohingya. So 30 years they have been back and forth, they're pushed, but like August of 2017, there is a huge crackdown on them. So about 800,000 people left Myanmar to come to Bangladesh. And there were a lot of death, a lot of rape, a lot of atrocities. And they came like that, you know, walking. They had to walk 10, 15 miles. And many of them are pregnant at that time. Many of them had, you see these, they were coming. They're living in Cox's Bazar like this. In one small area, they're living 700, 800,000 people are living like this. And Hope Foundation, we are right there working for 20 years. So we are one of the people that, one of the group that moved really quick to get help. So one of our midwives is delivering baby in the tent. And this hospital that we set up, this is the largest women's hospital in the camp. We set up from Hope Foundation. This is our waiting area. This is the busy time, so many patients. This is important for public health site. You know, there are a lot of studies to be done. This is a maternity area. So you see, there are about, right now, 40,000 women are pregnant. So there is a huge maternity need. And last year, I was told that last 2 years since they came, there are about 100,000 babies are born in that camp. So this is our female ward here, and we have a 50-bed hospital there. And this is basically infectious disease. A lot of so this is some training that we have a lot of foreign volunteer doctors, nurses, midwives. They go for training. We do different kind of training. And I was happy to meet Angelina, and that she was there, and we had that was the highlight of my isn't it? So I have another small video that CNN did. In August of 2017, over 700,000 Rohingya people were being pushed out of Myanmar. They took refuge in Cox's Bazar. Many of them have been tortured. Many of them have lost their family members. I'm Dr. Iftikhar Mahmood. I'm a pediatrician. I practice in the US, but I was born in Cox's Bazar, Bangladesh. So Hope Foundation is a non-profit charitable organization that focuses on maternal and child health. So this place is called Hope Field Hospital for Women. So this has been focused on maternity care, and slowly we built it up through the support from different donors. One of them is through the foundation. This is like a war zone. A lot of them have been subjected to this kind of violence and lost their family members. So there are a lot of mental health issues going on. At Hope Foundation, I want to thank all the volunteers that helped us build this beautiful hospital right here in the middle of nowhere. So that was done by CNN a few months ago when I was there. So this is what we did. I mean, it's a lot of work. It's not easy to put it together in a few minutes. But we have seen last year alone, we have seen 222,000 patients. That many women, almost 180,000. And as you can see, we trained over 1,000 people in different emergency training. It's a huge impact. We conducted over 2,000 births. Right now, Hope's capacity, we have 530 staff. We have doctors, nurses, midwives. We are the only provider in the town, 24/7 care for anybody who needs emergency obstetric care. And also, you know, we run the organization by some principles. I set these principles because it's very important. And any third world country, one of the reasons that we cannot advance because of corruption. irregularity, corruption. We all know it, and corruption is everywhere, but sometimes it is rampant, So I tell all my people that work with us, everybody has to abide by these principles: honesty, integrity, and service. We put this in writing everywhere, every wall that we have, so every day they can see it. If anybody does something they're not supposed to do, other people can remind them. Future, what is that? I saw that is what probably Dr. Ona asked me to come here, talk about, how we are strengthening the system of Bangladesh, or how we are contributing to that country, this healthcare. So our future plan is health system and strengthening by partnership with the government and other stakeholders, improve access to quality maternal care through expansion of birth centers, innovative programs to take healthcare to doorsteps of vulnerable people, expand training programs. I put in red research and data. We don't have much of it, that because it's important to keep some data, because other people can learn from it, because there will be many other countries like Bangladesh. So since we are doing this, and maybe we can work with you, school, maybe get some, data published. Maybe some students want to go there, because there I have hosted thousands of doctors, nurses, students in the past 10 years. And we're very good in hosting them, and their experience is good, learning experience, and in a comfortable setting. So if any one of you interested, any one of your friends are interested, and you want to go spend a few weeks, a few days, please contact me, and Dr. Ona is here. So this, as I said, we are building this. It's going to be a good center for fistula and maternity. Also, we are building this. We're going to start construction next year. This is a training. Initially will be used for fistula training, but after the fistula is gone, it's going to be regular training, of course. And there will be some residential facilities. And also, we are putting this maternity center. Solar power is being customized, built in Germany. So we're going to put in an island where there's no electricity. So this will be run by electricity. The island has 400,000. We have many other, in a short time, I don't want to bore you with so many, ideas, but this is coming. And we are already got kind of grants for about 12 birth centers. We work with, different donors. So we could, in the future, we're going to put birth centers, as much as possible. But this is what the main thing I'm going to talk about, at the end of my talk. So with all my work in these years, especially focusing on mother, from day one, I focused on mother, right? So I was trying to figure out what is that we can do that can be replicable? What can be the other people can just take it and run with it, do things immediately. So it came to my mind with working with these midwives. So if I can pregnancy care simplify it, right? If they just get it right away. So we don't have to explain, we don't have to give big books and big manuals to read through it before we're doing it. So this conference I did, a few weeks ago, 700 midwives came, government officials came, a lot of people came. So I promoted this. I said the maternal care should be as simple as a chain, right? Where the mother, when the mother is pregnant, and I know that mother is pregnant, I am with her until she gives birth. That is it. So in country like Bangladesh and like Indian subcontinent, and you probably know the cold chain is very jewelry, very, popular with women. Everybody wants to have a cold chain. So I said that if I can put this in their head, like the maternity care is like a golden chain, because all the links are together. You cannot break the link. Once you break the link, it's not a chain anymore. Right? So that means once you know the mother is pregnant, until she gives birth, the follow-up, she's with you all the time, and everybody supports that mother. So I was so happy that everybody loved that concept. And now they're all in Bangladesh. All the midwives are talking about it. All the government officials went there. They loved it. So, and we are trying to promote this. We're going to get a lot of workshops and meetings just about this. It's as simple as this. We just involve family members as possible. Give 3 to 4 antenatal care. That's all. And Antenatal care is nothing but doing a checkup, doing the urine test, doing the hemoglobin, that's it. And give the prenatal vitamin. Give the prenatal vitamin, you can prevent many diseases, including the cleft that we saw. Just the folic acid, prevent spina bifida, that's it, and the growth of the baby, and so many things, right? Ultrasound, you can diagnose if there is any like positional problem, and ultrasound is easy. Everybody has ultrasound. Every country has ultrasound now. It's just to understand that you need one ultrasound. And identification of high-risk pregnancy through this, refer the pregnancy, the person to, and also you can prevent unnecessary C-section. You reduce maternal mortality. You eliminate fistula. You basically, if you take one village and say, I'm going to do golden chain care in this village, you basically eliminate maternal mortality there. And also you make, as I say, you make the entire village a healthy village. The kids can go to school, the husband can work, and the mother can work. And, you know, a lot of Bangladesh, you know, our prime minister has been woman for the last 25 years. I don't know, many of you probably don't know. We had two prime ministers, both of them women, for the past 25 years. We are a women-led country, and our garments industry is very strong. It is the second largest garment industry in the world, next to China. And 95% of the garment workers are female. So we have a very strong female workforce in that country, you know, because they want to work, right? We're not talking about everybody is like staying home and raising kids. They're working too. But they need care as well. Who's going to do that care? People like us, right? And I'm trying to, like, I don't preach, you know, I just try to tell what I do. And people, young people are watching it. And I'm sure many will follow the footsteps. Because by doing this, you know, I think they see the impact in the society, impact their own life. And also they can see that person like me doing it, coming to the U.S., you know, get the highest education. As you know, I mean, in this country, and a kid like me at that time going to like that training in Cornell is just a dream come true, right? So I was lucky to have those kind of things, and I want to spread that luck for other people. And show this again, that focusing on mother is actually the strength in the health system, because you don't have to do complicated care if you can focus on mother. This is what I want to see, the woman in a village with a healthy baby, healthy outcome. That's what our dream is. That's what my dream is. That's what Hope Foundation's dream is. And that's it. Thank you so much.
Do we have any questions for Dr. Mahmood? Dr. Nath?
How do you balance your practice in the U.S. with the enormous amount of work that you do in Bangladesh?
Yes. So, you know, it's just, I think it's a matter of, you know, building the habit and also balancing it. Like, for example, I've been for 12 years, about 14 years, since 2005, since we built the hospital, I've been working part-time. So I work 3 days or 4 days a week. Now, the other days I do the, you know, and networking, visiting, that. I used to go twice a year to Bangladesh. Now I'm cutting down more work and I have a simple, very simple. My son is here, by the way. Can you stand up? Stand up. So you can see. He's here. He's in 12th grade. You know, I take him sometimes. I take him to Bangladesh also. You know, and so basically, I live a big, simple life. You know, my income is small. And I don't go for an expensive lifestyle, so I don't have to work too much, right? And you know, I honestly, by doing this, the balancing, it's a little hard work, but if you enjoy it, any work that you enjoy, it cannot be hard. You know, I really enjoy this. If I didn't do it, probably I would be really regretting that, you know, why didn't I do it? The more I do it, I feel better. And you know, every day I go to bed, honestly, this is true, especially for the, you know, students, you know, like for medical students and students. Every day I go and if I question myself that, you know, why did I not become, wealthy physicians, things like that? Then I think about this woman, I think about fistula and PPH, postpartum hemorrhage. Every time I think, sometimes I feel difficulty, I feel regret about, my bank balance and things like that, I think about the PPH, postpartum hemorrhage. Think about it, postpartum hemorrhage. She just gave a birth and she is bleeding, right? Only consequence is death, nothing else. If you don't have somebody take care of that, death, right? So if you focus on that part, nothing matters to you. Because then how many PPH mother we saved? Just one thing, right? So I think about that. Whenever I'm difficulty, I think about them. And nothing comes difficult to me anymore. Does it make sense, Dr. Dean?
It does make sense. I wanted to say that clearly your father's inspiration to you, that you have fulfilled his promises, his expectations. And it's really such a pleasure to hear your story. And I know that the students in the room are thinking, oh, how can I build this into, some of them are thinking, how can I build this into the way I practice medicine? So thank you for sharing.
Thank you. And for the students, I tell you, you can build it. Because being a physician gives you so much leverage that nobody else has it. You can work even 2 days a week, you can live a comfortable life. I did. My son is here. You tell me, I've never had to, have to go through any difficulties, and you don't need to work full time. Like Dr. Ona is running around, going to all the places.
Pretty much. Tell my boss that I shouldn't be.
Yeah, running all the places, right? And changing the world, right? We all can do it. Nobody is better than a doctor to change the community. I tell you that. Nobody is better than a doctor or a public specialist to change the world. And I am determined. I want to come back in 5 years from now and tell you everything that I said, I will do it. I'm determined to do it because it is so easy to do it. How difficult it is to do, sit down with a bunch of doctors or a bunch of midwives and convince them or motivate them, say, let's do this. Why should you do it? Because you're going to save lives. You're going to make better the community. Who else can do it? Politician cannot do it. Politician will never do it. But we can do it, and we took a Hippocrates oath, that's what our life goal is, and I am hoping to take more time out of my practice and go to talk to students, medical students, because they have this enormous potential to change the world. Even one student like me, who I was motivated my dad, but you can be motivated by any. I have inspiration from other people in my life, by the way, but I didn't want to take too much of time. But one person even can change a small community is good enough, because you see, I was telling Dr. Ona this morning, we cannot build hospitals everywhere. But if you can build one hospital in one place, other people can follow you, because the creating model is the most important thing. Model of, image of credibility, image of, say, good governance, things like that, other people follow, because what we lack nowadays in every society is a good role model. So all of us have to, as a physician, I think we have a chance to be good role model. And the students, I tell you that you will be, if you do, let me tell you this. If you focus on people that are vulnerable, that your life is successful, because you will get benefit from just thinking about them spiritually. You have a lot of difficulty in your life, it will not look like any difficulty. Because students, when you graduate, we have a lot of loans and things like that, right? A lot of loans, a lot of responsibilities, especially young people. But you have a focus in life of helping people. Sometimes, even though difficulties are there, you're not going to feel, I'm telling from my own experience. I never felt that kind of pain. If I did, I will not be here. I'd be like some of my, unfortunately, a lot of, a lot of my friends, they did not follow my path, but a lot of them are doing good things, by the way. A lot of doctors are doing, always they're trying to help, free treatment, going to community clinics and things like that. We're doing voluntary work. My one is a little bit extreme because I was so, as I say, my dad was influencing me, of course. And I have also, even when I was a kid, these things bothered me. I wanted to take some action, and I am taking it, and hopefully I can come back again in a few years and show these centers done and some other centers. Now, I don't want to care about centers more, but I want to care about the people that we took care of. Give you some success story, because every success story that we tell, there are 1,000 success stories behind. Every difficulty that you see, there are 1,000 difficulties behind us. In that we don't see. So I'm going to tell you, hopefully in the future, more success stories. And I would invite you, if you have, thinking of going overseas, to see how it is. It is worth it, by the way, because until you go to that culture, you will not know how good they are. Until I came to America, I did not know how good Americans are. But believe me, it changed my life. And when I see the goodness, I see the truthfulness, honesty. That's why I put honesty as number one. When I see the honesty that I didn't see some other places, I was very happy. I was convinced that it is a good virtue, that we need to practice it. So until you go out of the way, comfort zone, you don't know what is out there. So I would encourage, if you didn't go overseas, you should go. And if you didn't go to Bangladesh, you should go to Bangladesh. I think there is a nice airport, there is a nice hotel. I'll take care of you.
I have a quick question. I was just wondering how much of your funding comes from Bangladeshi Americans and how much comes from other?
First 10 years, it's been 20 years now. First 10 years, 90% of my funding came from Bangladeshi Americans. Small funding, but I used to go out because I used to go out and meet a lot of Bangladeshis, not for the money itself, but to know them, to involve them. Right? I used to spend a lot of time with them. So that was last 10 years. Slowly, I'm going to funding agencies, banks, and I'm trying to get money from people, wealthy organizations, because they have a social responsibility. They call it CSR, corporate social responsibility, yeah. So they have funding, so I try to use that. And now also I'm trying to do bigger projects. Like before I was thinking of 1%, and now I'm thinking of say, if I can apply for 10% or 20%. And now I'm planning to get, you see the hospitals, and I'm building the maternity center hospital. So that's 75 beds. So I designed a prototype, smaller one, 35 bed type. So I am now looking for funding, multiple of them in different places, so we'll be able to take care of the referral patients for emergency care and all this. Yeah. Especially I'm focusing on emergency obstetric care. Because if the midwife cannot handle it, then they have to send to someplace else. I don't want them to go to, if possible, not to go to a private hospital because they're expensive. Sometimes they don't do ethical practice. So I want to make sure that they have access. Also, we work with the government. We're trying to strengthen the government, which I did not mention here. We're trying to strengthen government district hospitals, especially their operation theater. So equip them and train them so that they can take care of it. Because government, their posting is there, facility is there. Sometimes they're not well taken care of. So they cannot do the work. So I'm going to different district hospitals and sub-district hospitals and try to refurbish them. I work with a lot of suppliers in the U.S., free equipment and things like that. So, and also train them so they can take care of this.
You mentioned research. I'm wondering, when you think about the kinds of research questions that would be most helpful to advancing your work, is it in sort of the realm of quality improvement kind of research, or is it more sort of epidemiologic or clinical research? What are the burning questions in your mind?
I think that we definitely quality research to be also, like a lot of things that I'm doing is kind of a little bit new. So I want to impact research. For example, the midwifery. How the midwifery, I'm saying things like the midwifery is going to drive down maternal mortality, but what is the evidence, right? So two can put together system work like that. And also we do telemedicine, like we work with a telemedicine group. And telemedicine is going to be widespread in the near future, I think. In Bangladesh, is already here also, but in Bangladesh also. So we have some telemedicine, to do telemedicine research, the impact studies, and then also, you have there are like people talking about research in clinical, like antibiotic research and all this, that can be done for infectious diseases. But what also the fistula, maternal health related research, I would say, to answer your question, I would say like quality improvement and impact.
Yeah, I was gonna say, so I so admire what you're doing, and I'm an MD/MPH student, and we had a class yesterday, and we were talking about how hard it is sometimes for nonprofits to stay open for an extended period of time, and I really love the fact that you're focusing not only on eradicating fistulas, but what your organization will do after that. I think that's really cool. I was wondering, since that is so difficult for nonprofits, was there ever anything at any point in time as Hope was growing that you thought, I can't imagine getting past this? And also, as you're getting larger and larger donations, which is awesome, does that ever come earmarked, and how do you manage to stay focused on your mission for Hope and for this community?
So there are three questions, actually. One is, struggle, right, in the beginning of struggle, right? And other one is that working with the large funding agencies, and also the future, I think there's, so first 10 years, I thought many times that I have to close because of funding, the working with people. You see, the thing is that in this, I have to tell, if somebody is starting it, I will tell them that to be very, very patient. And I'll tell them that if you have a dream, do not ever give up, even if it doesn't work for you. A lot of dreams fail, a lot of dreams fail. Even if you fail, don't you give up. You fail from something else. Somebody shut you down or something like that. If you have a dream, never. Because if you give up, you will never be able to start another one. Right? If somebody shut you down, you're going to take a pause, and I'm 100% sure that you're going to start another one. Because somebody else, so you have a chance to blame somebody else. Because you are not the blame. And you will start, even if somebody shut you down, right? So that's number one. So I would say from my case, it was 10 years. That it took. Somebody probably 5 years. Somebody it can be 2 years. And 2 years can be very, very painful too. But my 10 years was very painful. But as I said, I was a physician, right? So I know that I could sustain because I have my own income. I was working hard. When I was having a struggle with my foundation, I was working, really putting a lot of hours so I can put my money there. Because what is the struggle is mainly funding, right? And other things, you have to work on groundwork, and you have to have that ability to work with the people. So that's number one, right? So the other thing is that you mentioned about the funding earmarking, right? So right now, as far as, I'm concerned, that earmark funding I try to avoid. Smaller, but if it's a big earmark funding, like for example, I'm going to give you $500,000 for this, I work with that because that's enough money to, like run a program. But if somebody give me $1,000, I want this, I try to avoid. I say, I can't do it, I cannot fulfill the commitment. I will not take any money that I cannot fulfill commitment. And third question is that, like the future. Right now in Bangladesh, at least, like the funding agencies that work in Bangladesh, over time, I built a credibility, so they believe in, I got like proposal, to do different things almost every week, big and small proposals. And now I have the option to pick and choose. And I can tell that I want to do this, or I will do it by my way. I get even proposals to, build nursing school, medical school, but it's my priority. No, I don't want to produce physicians. You know, I would rather produce midwives, nurses, you know, you see the proportion. So I have to know what I want to do. You know, because, you know, I don't know about here also, medical school is always it's a business. You know, it's always a profit. There is a profit, there is an investment, there is all things. And also, you know, the people come, you know, they pay and they become doctor and they have their aim in life, right? But nurses, I've seen the nurses and midwives, when they come to this profession, they're really passionate about it. You know, so for a country like Bangladesh, you get more out of what you do. You know, so like whenever somebody come to me with the proposals to say, I wanted you to do this, and I sit down or I like think about it and I make sure that I do you see, I have a goal. I have that circle. I have the mother focus, you know, that's it. I don't want to go beyond that right now. I want to see the maternal mortality in 10 years' time below 70 instead of 196, because that is what we call Sustainable Development Goal. I don't know if you have heard of that. Sustainable Development Goal is a standard like that now we are following right now. That's what our aim is, everybody in the developing world. So we want to have the maternal mortality below 70. If I can do that, I can contribute to do that in our country, I think that is what I said. And what do I have to do? Do I have to start a medical school? No. I need to train the people who are in the field and so they can do the safe delivery. So maternal mortality goes down. Does it make sense?
I know that students have to get to class, but I want to thank you again for sharing your story with us and inspiring us. So thank you. I know the students may want to ask questions individually, but I'm also very sensitive to the time and also their hunger pangs. And there is food. So please help yourself.
Grab a plate.
And also, if you can put your evaluation form in the box here before you go, I would appreciate it.
Thank you so much. Thank you.
Great amount. So we don't have a board.
Hi, how are you? Hi, I'm Colin. You are. Thank goodness.
MP.
I'm going to say,